Hi doctors, it's me Buddy. I'll be reviewing with you today. But first let's review a concept from our last video on postpartum hemorrhage or PPH, which was previously discussed by my friend, Pearl. This table shows you the pharmacologic management for PPH. For the immediate treatment, you can give oxytocin and/or ergometrine. For early management or when bleeding is not controlled, you can administer tranexamic acid and carboprost. And lastly, for maintenance, you can administer oxytocin or misoprostol. Here's a note for you to remember this in your exam. You can watch the discussion on the approach to PPH and more MCQ in this video. Please check the link below. Now, following our series on answers to the questions in the AMC Handbook, let's jump into the section on mental health and discuss some of the questions. Starting off with the first question. A 28-year-old investment banker presents for advice and treatment of persistent premature ejaculation, which he attributes to fatigue from his job and his new relationship. Which one of the following would be the best approach for his long-term benefit? A. Interview him with his partner. B. Teach him relaxation exercises. C. Instruct him in the use of penile squeeze techniques. D. Prescribe sildenafil, Viagra, 1 hour before attempting intercourse. E. Prescribe low-dose clomipramine. Interviewing his partner either separately or together with the man is of dubious long-term benefit. Most men with premature ejaculation may have an extremely sensitive glans penis, and options B, teaching relaxation, and C, use of penile squeeze, are not the recommended methods for long-term benefit, nor is the prescription of benzodiazepines for anxiety. D. The recent controlled trials on Viagra have not demonstrated any efficacy, despite reports on its use for erectile dysfunction. E. The selective serotonin reuptake inhibitor or SSRI antidepressants and clomipramine have dramatically changed the treatment and outcome of premature ejaculation. E is correct. Several studies have shown consistent benefit from using fluoxetine, sertraline, paroxetine and clomipramine in the treatment of premature ejaculation. A 21-year-old medical student presents with a 1-week history of increasing arousal and hypervigilance. He reports that he is God and describes believing this when he first put on a white coat 3 weeks ago. This abnormal belief is an example of which one of the following? A. An illusion. B. A hallucination. C. A passivity phenomenon. D. A delusional perception. E. Thought insertion. A. An illusion is a false perception that may arise from misinterpretation of a true stimulus. This is quite common in children and is not considered abnormal because individuals have been deliberately misled, example by a magician, or there is a lack of visual clarity. B. A hallucination is a false perception of an internal stimulus which is interpreted as being from outside oneself, and is spontaneous and involuntary. To a patient, a hallucination will appear to be a normal, real sensory experience. Auditory hallucinations are noises, voices or music heard and experienced in the absence of external stimuli and may have a similar quality to a true perception. Hearing voices is characteristic of schizophrenia, but it may also occur in alcoholic hallucinosis and affective psychoses. C. Passivity experiences occur when people believe that their behavior, actions or feelings are not their own but are the result of external control by other people or computers, etc. For example, when a psychotic patient is experiencing the movement of his own limbs like a passive observer. This is typically found in schizophrenia, and the person experiences thoughts, feelings, impulses and actions as being foreign or alien and not within his control. D. A delusion is a false, unshakable idea or belief which is out of keeping with the person's educational, cultural and social background. It is considered extraordinary and irrational. The characteristics of a delusional perception are that it is sudden, urgent, and false. As in this case, in which the patient believes that he is God, something that is beyond normal logic. D is correct. E. Thought insertion is the experience and belief that one's thoughts have been placed inside one's head by some mysterious external source. A 42-year-old academic has sought help from you for alcohol abuse. The most striking feature is his lack of emotional warmth and rapport. He tells you he has never married and has no friends, but is devoted to his work as a research economist. His only interest is playing fantasy games and chess on his home computer. He describes himself as introspective and self-sufficient, and has always been aloof and ill at ease with people, even his family of origin. Which one of the following is the most likely disorder of his personality? A. Antisocial. B. Schizotypal. C. Schizoid. D. Avoidant. E. Paranoid. Individuals who are isolative, unsociable, emotionally reserved and introverted, those who lack social skills and prefer their own company, have few friends, rarely marry or express any interest in sexual activities, but nevertheless work successfully, are considered to have schizoid personalities. They may become interested in physics, mathematics or religious philosophies, but are rarely concerned about world events or other people. This man is a classic example of schizoid personality disorder. C is correct. The main differential diagnosis would be paranoid personality disorder, where there is more social engagement and verbal interaction, and often a history of anger or aggressiveness, and avoidant personality disorder. D. People who are avoidant yearn for close relationships, whereas people with a schizoid personality disorder actively avoid them. A. Antisocial personality disorder is characterized by disregard for other people's rights and by irresponsibility. B. Schizotypal individuals would be more odd and eccentric with less likelihood of occupational success. As part of the mental state assessment of cognitive function, patients may be asked to subtract 7 from 100 sequentially. This serial sevens test is primarily a test of which one of the following? A. Registration. B. Digit span. C. Concentration. D. Abstract thinking. E. Memory. Candidates are expected to be able to use and interpret the Mini Mental State Examination, or MMSE. Serial sevens is one of several methods of assessing concentration and attention, together with digit span, spelling a familiar word backwards, such as world, DLROW, or recitation of the days of the week or months of the year in reverse order. C is correct. A. Registration is the ability to repeat 3 objects, a brief story or a name and address, like new information and not the recall of old information. B. Digit span is not serial sevens, but is another useful confirmatory test of attention and concentration. It is where a person is presented with a sequence of 2 digits, then the person needs to repeat the sequence. If the person can repeat the sequence, then a longer sequence is presented. This goes on until the person can no longer repeat the sequence. The longest remembered sequence is the person's digit span. E. Abstract thinking refers to higher order cognitive and intellectual functioning and involves the use of logic, problem solving and reasoning. Proverb interpretation, planning a menu or understanding a humorous story or joke, doing a crossword puzzle, explaining the differences and similarities between familiar objects are all examples where abstract thinking is involved. Frontal lobe lesions, schizophrenia, and intoxications may each impair abstract thinking. Serial sevens does not depend on memory. Please bear with me with this lengthy question. A 32-year-old woman presents seeking counseling after the news agency in which she works was robbed by a man with a knife who threatened her and a customer. She is now anxious and hypervigilant, and her sleep has become disrupted by nightmares of the incident. She is adamant that she does not want medication but asks about the outcome of the counseling. Which one of the following would be the ultimate goal of her crisis intervention counseling? A. To bring about a lifelong change in her personality. B. To restore her to her pre-crisis level of functioning. C. To promote a cathartic retelling of her experience. D. To facilitate her subsequent referral for long-term psychotherapy. E. To provide emotional support during natural healing in response to stress. Crisis intervention is a specific form of counseling developed to address psychological difficulties that can arise abruptly and threaten the equilibrium of an individual after a traumatic experience. The objective of crisis intervention is to help the individual deal with the stressful period and return to his or her pre-crisis level of functioning. B is correct. Unlike dynamic psychotherapy, it does not focus on psychological insight, personality issues, or psychiatric disorders. D is incorrect. C. Catharsis may occur during crisis intervention but is not necessary for crisis intervention. A 24-year-old fashion model and minor celebrity presents after having used cocaine at a party a few days ago. She has been high and appears euphoric, elevated, hyperactive, and restless. Her urinary drug screen is negative. She insists that this is just an exaggeration of her normal self and that she is usually quite emotional, with short-lived highs and lows, tantrums and tears, which is corroborated by her partner. She is quite concerned about her physical appearance and demands a mirror so that she can look right during your interview and touch up her face with makeup and lipstick before she speaks with you. During the interview she is disinhibited and flirtatious, flatters you with compliments and asks you out on a date. Her mental state examination is otherwise normal. Which one of the following is the most likely diagnosis? A. Cocaine intoxication. B. Undisclosed ecstasy usage. C. Histrionic personality disorder. D. Cyclothymia. E. Hypomania. Although this young woman has clinical features consistent with recent cocaine intoxication, her urinary drug screen is negative. Cocaine is rapidly metabolized and excreted in the urine. The metabolites are cleared from the urine well within 72 hours, so a negative urine means that persistent cocaine intoxication is unlikely. You would also expect to see physical signs of recent ingestion including pupillary dilatation, pulse, temperature and blood pressure instability, sweating and psychomotor agitation which are not evident here. A is unlikely. B. Ecstasy or MDMA is an amphetamine which produces short-lived euphoria, increased gregariousness and sociability, as well as anxiety and agitation. Dehydration is a significant complication of ecstasy usage and secondary hyponatremia may result from excess water consumption. Given the clinical features in this scenario and the absence of amphetamines in her urine, she is unlikely to have been using ecstasy. C. Histrionic personality disorder is characterized by excessive emotionality, flirtatiousness and attention-seeking behavior. C is correct. Individuals with this character type are dramatic and theatrical, who dress to impress and are overly concerned with their grooming and physical appearance, as in this case. D. Cyclothymia is primarily a chronic mood disorder characterized by hypomanic and depressive episodes. The mood fluctuations are neither severe nor long enough to satisfy criteria for a bipolar disorder. It is a milder form of bipolar disorder. Her history does not suggest such well-defined prior instances of mood disorder, but rather a continuing pattern of labile emotionality and ephemeral mood and behavior changes. E. Hypomania is a distinct period of mood elevation or irritability lasting at least 4 days, accompanied by grandiosity, inflated self-esteem, reduced sleep, pressured speech and flight of ideas, distractibility, increased energy, psychomotor agitation, overspending, poor business judgment or sexual promiscuity. You have been visited in your general practice by a pharmaceutical company representative accompanied by a researcher from the local university's Department of Clinical Pharmacology. They request that you recommend and refer patients from your general practice with insomnia who would be considered for a trial of a new non-benzodiazepine hypnotic. Which one of the following is essential for your agreement? A. Clarifying the sample size and the number needed to treat. B. Establishing the known side effect profile of the drug from earlier clinical trials. C. Verifying that the study has approval from a Human Research Ethics Committee. D. Ensuring that your patients receive adequate financial compensation for their participation. E. Insisting that you have co-authorship of any scientific papers that may result from the study. In Australia, all human health research, including clinical trials, cannot proceed without such approval from the Ethics Committee. It is the most important requirement. A 72-year-old woman has been brought to the emergency department after falling in the street and fracturing her wrist. At the time she was carrying a large number of plastic bags filled with assorted rubbish, decaying food scraps, sugar sachets, used tea bags, newspapers and discarded advertising brochures. She was dirty and unkempt, but was neither delirious, demented, nor thought disordered. She admitted that she also saves abandoned cats and keeps at least a dozen at home. Her daughter arrived and confirmed that her mother hoards rubbish and bric-a-brac at home and her living conditions are filthy and squalid. The name of the syndrome which describes this domestic state and her clinical presentation is which one of the following? A. Charles Bonnet. B. Ekbom. C. Cotard. D. Diogenes. E. Briquette. Charles Bonnet syndrome refers to the experience of formed visual hallucinations in blind or partially sighted elderly people who are not delirious, dementing or psychotic and in whom there is no disturbance of consciousness. There is always ocular or occipital disease in this condition, which is not a psychiatric disorder. There is an organic explanation for their visual experience and that it is not indicative of mental illness. B. Ekbom syndrome has 2 forms. First is the delusional infestation with parasites or worms in patients with schizophrenia. Second is the irritable legs or restless leg syndrome. C. Cotard syndrome is a specific form of delusional disorder in which the person believes that they have lost important body parts, blood, or internal organs. They may also deny that they have a name or an age. The condition may also occur as part of the mental state in schizophrenia or bipolar disorder, non-dominant temporoparietal lesions, and migraine. D. Diogenes syndrome refers to the decline in personal hygiene, and sometimes the hoarding of useless items, in people with significant frontal lobe impairment, which may be part of a dementing process, schizophrenia, or chronic alcohol abuse. It is commonly seen in general practice and geriatrics, as well as community psychiatry. D is the answer. Briquet syndrome is used to describe somatization disorder. Patients have chronic, treatment-resistant, multiple symptoms for which no organic causes could be found. A clinical assessment of a 30-year-old woman shows a 15-year history of fluctuating bulimia nervosa. Which one of the following would be least likely to be found on physical examination? A. Swollen salivary glands. B. Dental decay. C. Calloused knuckles. D. Hirsutism. E. Amenorrhea. Salivary gland hypertrophy is quite common in bulimia nervosa and gives a chubby cheek appearance to sufferers. B. Dental decay occurs with bulimia nervosa because of the erosion of dental enamel following self-induced vomiting. C. Callous knuckles, previously described as a Russell sign, is caused by putting fingers in the mouth to stimulate the back of the throat and induce vomiting. The calluses arise following the upper teeth rubbing against the dorsal aspect of the fingers. Skin ulceration may occur as a consequence. D. Hirsutism is the only response which is not a typical clinical feature. It is the presence of masculine hair distribution in women, particularly mustaches and beards. Hirsutism is not to be confused with the lanugo hair that is seen with emaciation or anorexia nervosa spectrum. Lanugo hair is the pale, fine and downy hair growth over the dorsal aspects of the limbs and is quite different from the hair growth in hirsutism. D is correct. E. Although amenorrhea is more common in anorexia nervosa and is a diagnostic feature, it can also occur in bulimia nervosa. This is due to suppressed sex hormone secretion as a consequence of fasting and prolonged dietary restriction. A 28-year-old ballet dancer presents with a sprained ankle. She has been appearing as part of the corps de ballet in a nationally touring company and has had to perform 6 times a week since the ballet season began 2 months ago. She tells you that for the last 3 months she has engaged in self-induced vomiting several times a day, partly out of performance anxiety and partly to control her body weight. Her sprained ankle was the result of worsening fatigue contributing to a fall during a performance. After effective treatment of her ankle injury, which one of the following would be the most appropriate initial investigation? A liver function tests including serum albumin. B is serum electrolytes, creatinine. C a full blood count and serum iron. D. Thyroid function tests. E. Fasting glucose level. This scenario suggests that this young dancer has bulimia nervosa. Electrolyte disturbances, particularly hypokalemia, which are caused by induced vomiting, are common and important clinical features. Hypotension and the risk of potentially fatal cardiac arrhythmia due to hypokalemia mean that measurement of the serum electrolytes and creatinine is the most important initial investigation in this situation. B is correct. Although the other investigations are important, they are of less importance considering the major threat that the electrolyte derangement can cause. A 20-year-old female elite athlete on a sports scholarship has presented for assessment after collapsing in the gym during a workout. One of the trainers who accompanied her says that he is concerned that she is overtraining and overexercising and that this is not the first time that she has fainted during a gym workout. As part of a mental state assessment of this woman, which one of the following is the most likely abnormality in her cognitive content? A. Thoughts about suicide. B. Fears of losing control. C. Obsessions about cleanliness. D. Concerns about her weight and shape. E. Infatuation with a fellow student. This scenario tests clinical reasoning and the ability to recognize that this young woman has an eating disorder characterized by overexercising and has collapsed due to depletion/dehydration either from vomiting or from diuretic or laxative abuse. D. Having concerns about her weight and shape is the only one which is specific to an eating disorder. Suicidal ideation, obsessions about cleanliness and infatuation may be present, but are less likely to explain the circumstances of her presentation. A fear of losing control is a nonspecific anxious cognition. That ends our review on the first 10 questions in mental health. Feel free to share this channel to your study mates. Review well.